Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be going over how to treat a patient with a herniated disc. The very first thing that we're going to do is analyze his posture three-dimensionally on the XYZ axis. So we're going to do that by having Renee close his eyes, flex your head forward all the way, please, sir, and backward all the way. Now, as you see that, you can tell his head's not going forward and backwards evenly. And take a deep breath. Let it all the way out. Now, in this postural view, you see that his head is not only forward tipped down, but you also see that it's translated to the right on the x-axis. Plus, if you look at his right ear, it's lower than his left ear, which makes his left shoulder come up high. Now, he is a lumbar spine patient with a herniated disc in his lumbar spine, and as you can see, he has a pelvic translation to the right on the x-axis, and he also has a little rotation there. It was a lot better than it has been. He's got some rounding in his shoulders here as a result of that forward head posture. So the very next thing that we're going to do now, you can open your eyes. We always have the patient look in the mirror so they can see themselves and see what their postures are, because we train our patients to know when they need to be adjusted. So the next thing I'm going to do is a spinal decompression on the y-axis. So we'll have you lay on your back right there. If you can loosen your tie up for me, I'll get that. And on this one, you just get a plain bath towel. You get it wet. You fold it up nice. And you want to put that right down here underneath of the patient's neck. We get the patient on the spinal, slide down this way, inertial extensilizer, and we get them to relax by raising their legs up so that the lower part of their legs are parallel with the floor. This changes the entire angle of the pelvis, relaxes the lumbopelvic paraspinal musculature, not only from the low back and pelvis, but also all the way up the spine to his occiput or skull. Now, he has herniations of the L4, L5 disc. So, we're going to pin his pelvic bone in right at the top of the iliac crest on that left side first, and then suck it up just a little. These are a little, you want to make sure they're in there very tight so that you get a good solid foundation there. There we go. You want to make sure the patient keeps their teeth closed. Okay, take a deep breath through your nose, let it all out and just relax. Yeah. We got one more little one. That's it. Okay. Very good. Now, we always check the patient's reflexes afterwards. His reflexes today are +2 equal and active bilaterally, as when we did this last visit, he had a diminished reflex in his right patellar reflex. Now, while the patient's in this relaxed position, we take this opportunity to do a very good cervical adjustment. This is a diversified adjustment of his cervical spine because he had an atlas subluxation as well as C5 and C6, causing his forward head posture as well as his head tilt. Now, while he's on the table here, you're going to see me do an adjustment where actually I'm going to decompress him from the lower part. So I'm going to get down to the base of the table here, and I'm going to line his hip up and watch his breathing. There we go. And I do a straight vertical, again on the y-axis, adjustment of his ankles, knees, all the way up into his hip and pelvic joints. Now, we're going to have him set up properly on the table, so let's have you set up sideways. Very good. And let's slide you over this way. Now, while we have the patient sitting right here, I always adjust the patient's extremities because he's got some crepitus, which is grinding and popping in his shoulder as I move it through a passive range of motion. Seems to be worse on the right than it is the left. Excellent. And then he works on the computer all day long. There, his elbow was out of place a lot today. That went great. Feel that? Mm-hmm. And we adjust the fingers as well. And we know that we've got a sympathetic or autonomic nervous system functioning right now. There we go. Because I can feel it in the moisture in his skin temperature. And that's a direct sign of the autonomic nervous system, sympathetic nervous system. Very good. Now, what we're going to do next is have the patient lie prone on the table. BioPhysics. Now, let's have you go face down. Put your face right down that little piece of paper. I'm going to have him prone. First thing I'm going to do is a leg check. Now, previously his legs have been short. Today they're exactly even. This is called a knockless test, and I can tell already, see his pelvis is raising up. Does that tighten up a little bit in your low back?
Yes,
but not as bad as it did yesterday?
Not as bad.
Yep, very good. So now I'm going to be adjusting his right sacroiliac joint on the X, Y, and Z axes. This is his left sacroiliac joint. You notice I'm doing different lines of drive and adjustments here. There's the right sacrum, the left sacrum, and then because he has a lot of compression right at that L5 sacrum disc, right there again on the sacrum. Now, I'll be going straight P to A, which is posterior to anterior, on his L5 vertebra, which is disc is herniated there. And there's L4. There's L3, and we got great movement on that one. That's the center of the lumbar spine. That was L2. And there's L1. Now you notice how my arms changed as I did the angles. We get some good lateral oblique stretches in the spine. Now you notice I'm not putting him on his side and twisting him. When you have a herniated disc or bulge disc or even degenerative disc, you do not want to create any more trauma or ligamentous laxity. Very good. Now right here is a stress area. There, at T11 and 12, we got that. Perfect. Now, we come down here and we do a post-adjustment check. Much better. How'd that feel compared to the first one?
Yeah, much better.
Much better. Good. Now, I'm going to let his head down just a little bit more right there. And we're going to come up here in his upper thoracic spine. There we go. And they just breathe normally. And let me have you. You got that one. Now, just let this drop. Excellent. Very good. Okay. Now, let's have you turn over on your back, please. Now, this next adjustment is very unique because I'm actually going to be adjusting his pelvis from the anterior aspect, and I'm going to be adjusting the top of his pubic bone the same way I was adjusting his sacroiliac from the rear. I'll be doing this one from the front. So what we do is we have him bring the opposite leg up and relax that. Now this one can get very sore for the patient, but what it does is it realigns the sacroiliac joint because you're adjusting the symphysis pubis down. Okay, very good. Let's do the same thing over on this side. And I'm going to, again, get right on the pelvic there area. Very good. Now, I know that that was an excellent adjustment. We're going to lift his leg up, called a straight leg raise. Is there any pain in your lower back or leg at all? A little bit? Okay, how about when I do this? Good, that's better. Now, we're going to do same test, straight leg raise test on the left. Is that still tighten up in your low back or not bad?
Not bad.
Okay, how about this one?
No.
Good. So, what we know now is that he still has some issues on this right side on the L4 and L5 nerves, as well as the sacroiliac joint. Okay, let's have you sit up here now. Yep, see, he knows how to get up properly. Very good. So, Renee, tell everybody how you've done since we started adjusting you with your severe pain. Just tell them how you came in and how you're doing now.
Since the first time I came in, I could hardly walk. I was limping. And since the adjustments, I feel 10 times better.
Great. Thank you very much. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.